Deputy Speaker, today I rise to speak in support of the new Aged Care Act, a bill that, while no silver bullet, marks a step towards rebuilding the structure, reputation and sustainability of Australia's aged care system. I congratulate the government for bringing this bill forward, and I commend the Coalition for their constructive engagement in the process and helping build a robust piece of legislation. I was recently invited to visit an aged care facility in my electorate to mark the awarding of an Order of Australia to a resident, Carmen Block. And please indulge me for a moment while I commend Carmen and his family for the contribution he's made in my community over many, many years. He's been a Lions member for the last 50 years, and that was why he was recommended and awarded the Order of Australia. And his commitment to his community and his commitment to volunteering and just helping people in times of need was remarkable. And it was wonderful to be able to celebrate that with his daughter and grandchildren as well. Daughter, grandchildren, and actually great-grandchild as well. So very, very special event. It was, as I said, at an aged care facility, and during that visit I spent about an hour or so with residents and with staff, and I was struck by the genuine decency, humanity and connection that was shared between staff and residents. What I witnessed was genuine compassion and care, and that is what all of us seek and want for our families. We all fear ageing, of gradually losing our faculties and independence that we take for granted for so much of our lives. We also fear becoming dependent, whether it is on a spouse, friends, carers or our children. A well-functioning aged care sector is a critical part of our social security safety net and provides assurances that the worst of ageing can be managed with dignity, respect and compassion. But I fear in recent years we have lost faith in that safety net. The need for reform has never been clearer. The Royal Commission into Aged Care Quality and Safety painted a harrowing picture of the failings of our current system. It showed us that too many older Australians have suffered not just from poor service, but from neglect and, in some cases, even abuse. The stories that emerged from the Royal Commission were heartbreaking. We heard of elderly residents left in soiled clothing, of people going days without adequate food. It revealed the human cost of allowing the system to drift away from a model of care concentrated on the rights of individuals, their wishes and autonomy. COVID-19 further exposed the fragility of the sector to external shocks. It showed us that the system was stretched to capacity and unable to adapt to a crisis, leaving both residents and aged care workers at significant health risk. When I speak to care providers in my electorate, they talk about the challenges they have to deliver the growing need in my community, but also communities around the country. The challenges in building more facilities, more wings, providing more beds, but also the challenges of getting the staff and the right staff in to support this incredibly important work. And I think certainly as a daughter who's recently lost two parents, one of whom was desperately afraid of going into aged care facilities, that fear that many of our community have, that they will not have the facilities in place and they will have to move to other parts of the country where they do not have the same connections to friends and families that they do in their local environment is a real concern.
That is so true.
And I also, just speaking briefly on Wentworth, one of the things that startled me the most is that the aged care provider, who was a provider of many aged care facilities around the country, said they have as much problem getting aged care workers in Wentworth as they do in some rural electorates because of the enormous cost of living and cost of housing in communities like mine. So there are some really significant challenges in the sector. We need to be honest, however, that the sector has been failing. It has failed residents, it has failed its staff and it has failed its community. But when I go into aged care home and when I go into and talk to other aged care providers, I think that there's a really important reminder that the majority of the sector is deeply committed to the preservation of dignity and quality of life for elderly Australians. The system has been broken, but it is not beyond repair, and I think this bill goes some distance to do that, which brings me to it. As I said, I commend the government for working closely with stakeholders and with members across the parliament to produce a bill that has received broad support from the sector and aged care community representatives. There are still some areas to strengthen and a significant part of this bill is actually in regulation. But stakeholders I have spoken to have acknowledged the improvements to this bill since the exposure draft. It is clear, that the government and others have been listening to the voices of those most affected by these issues, older Australians, their families and workers. And once again, I commend the opposition, the coalition, for their engagement, and areas where I know that my community does appreciate the changes that were made based on the opposition's feedback. This bill represents a substantial overhaul in the way that aged care is provided in Australia, explicitly legislating a rights-based model that acknowledges every Australian's right to age with dignity. It also introduces revised funding arrangements that acknowledge the roles of both home care and residential care in addressing both capacity constraints, as well as the wishes and needs of elderly Australians. This new rights-based framework is grounded in the principle that older Australians should be able to access quality, safe and timely care, and was a key recommendation of the Royal Commission. However, as a number of organisations have pointed out, these rights are not enforceable under the Act and will rely on the Aged Care Quality and Safety Commission and Complaints Commissioner to ensure that these rights are upheld. The Aged Care Act provides civil penalties for infringements on registered provider obligations, and this is, I think, a really important part of the Act. I know that there is some concern that these don't go far enough, but I also recognise that we need to find the right balance here to make sure that we are working constructively with our aged care providers and ensure that bad actors have always face the full force of the law, but recognise that there are many people and many in the sector who are working constructively and genuinely to improve quality of care and look after their residents in an effective way. And so we need to strike that right balance. The funding arrangements proposed in this legislation appear to be a sensible adjustments to the current user pay system, although I note that the community eagerly awaits the release of the rules that will actually determine the individual fees that will be charged. The bill maintains a means-tested co-contribution system based on services needed with different funding arrangements, subject to whether required services is considered clinical care, independent support and everyday living. This co-contribution model has caused some concern that the service quality of aged care will become dependent on ability to pay, and while the government has noted incentives for providers to provide ratios of supported residents, this is not mandated, and this is an area we do need to closely monitor. There are provisions that allow for a more sustainable sector, such as allowing services to retain up to 2% of the refundable accommodation deposits, which the sector has been requesting for some time. This will have an enormous impact on the ability for services in my community to expand, grow and invest. And I want to briefly note why this is important, and actually why the whole legislation is important. Our community is ageing. The great joy and the great benefit of this is that Australians are living longer and have a greater chance of living healthier lives longer in our country. But we also need to recognise the impact that has and the greater older Australians that it has on our sort of tax system and on our ability to fund the services that are most important. Back in the 1970s and 80s, there used to be 6 younger Australians, working age Australians, for every older Australian over the age of 65. This is now under 4, and in the expectation in another generation, this will just be under 3. So we do know that the community is ageing, and so the burden and the cost of actually providing quality services is going to increase, and we do need to face how we're going to pay for that, and pay for that in a way that burdens, shares the burden appropriately across different generations and across different people's ability to pay. And so I do acknowledge that this bill goes some way to trying to address that in a way that is fair, particularly for those people who are already in the aged care system and have made their plans, but also is thinking forward. A key part of the legislation, which I'm really happy to see, is the emphasis on home care. Now, when I talk to people in Wentworth who have had engagement in the aged care system, this is one of the things they talk to me the most about, is like how difficult it is to get home care in a timely way. When you're assessed for a package, you're on a waiting list, by the time you actually get the package, you're often significantly more unwell, have not been able to get the services you need right now to support yourself. And this can often precipitate having to go into aged care, where potentially, had you got the right services in your home when you needed them, you wouldn't have needed to do this. And so I think this emphasis on home care is really important. This bill will introduce greater flexibility, allowing older Australians to receive early interventions and a higher level of support, including services like meal preparation, cleaning and personal care, with an easier transition between different levels of care when needed. I also commend the government for expanding the end-of-life care pathways to allow more people to access palliative care in their home. And again, on a personal level, having seen my father go through palliative care and him having actually had the great benefit of having a wonderful palliative care team that he relied on very much in the end of his life, it is really important that we acknowledge the importance that palliative care can provide, individuals and their families at end of life, and also give people a chance to die at home, as many would like to, but many fewer actually ever reach that aspiration. But apart from the integrated assessment pathways, I still hold some concerns about the wait times to receive some of these home care supports. When an older person, as I said, is deteriorating, receiving timely care is absolutely essential. And I would ask the government to more explicitly address this issue in their work and in their future legislation. I would also like to acknowledge that a significant amount of the reform will be delivered through delegated legislation. And while I understand the need for the bill to pass quickly to implement these much-needed changes by next year, I know that the community eagerly awaits closer scrutiny of the aged care rules, which include the final quality standards, code of conduct, and how fees will be calculated. And again, this bill is a positive step towards a better model of aged care in Australia, but the market-based model means that the success of this legislation hinges critically on the ability of providers to provide adequate services, not to mention, addressing once again the issue I've identified earlier, which is the shortage of aged care workers. Currently, the Centre for Economic Development estimated in 2021 that we'd have a shortage of aged care workers of 110,000 by 2030. Bills that legislate rights and standards are promising, but unless we have a suitable and sustainable workforce, the standard of care and quality of care for aged care residents are likely to continue to be unmet. And this is an issue I mentioned before, how much this affects my community in Wentworth, where the chronic shortage of aged care workers means that aged care providers can't expand in the way that they would like to in my community, and are really concerned about their ability to continue to attract great aged care workers. And I am concerned, I'll be honest, that the government isn't doing enough in this area. Firstly, I want to outline that while they have brought in a migration policy to attract aged care workers from overseas, my great concern with that model is that it is tied up into basically an agreement between the aged care workers and the unions. Is only the way that those special fast-track visas can be accessed. And I have real concerns on that, because many of the providers I've spoken to do not have those union links at the moment, and would like to be able to work with other groups such as Fair Work or other government institutions to be able to access these workers without having to necessarily agree to all the requirements that the unions impose on them, because in some cases they feel that this is unnecessary or onerous. And I am concerned that their migration settings are not yet pulling that way. And I think the other issue I always come back to is that this place, and we as parliamentarians, we're very good at imposing obligations on businesses, and in aged care it's absolutely critical. But we should also be constantly thinking about how do we make sure that, are we right-sizing the sort of burdens that we put on individuals, on care providers? How to make sure that we can still allow for innovation, for growth and productivity in sectors like aged care, because this is an increasing part of our economy. How do we make sure that, when particularly for our frontline workers, that they are spending time on the care they want to give rather than on paperwork and bureaucracy. I used to work in a hospital, I've worked in education, and the feedback I got from the nurses, from the doctors, from the teachers, from the principals was consistently that they were spending less and less time on the things that mattered to them most and why they got into the sector in the first place, which is their desire to provide care and education to people, and they're spending more and more time on bureaucracy. And I think, the aspiration, of every government needs to be constantly right-sizing this, constantly coming back and saying, is this regulation, it's there for protection, but are there other ways of providing those protections while still giving people the flexibility and also unburdening the frontline workers so that they can do what they do best, which is provide care and education to those who need it. So in conclusion, Deputy Speaker, while I believe that this bill represents a good reform and a significant step forward, there is still further to go. We must continue to push for greater investment in the workforce in particular, address long wait times for care, ensure the reforms are implemented in a way that truly benefits older Australians, but also allows innovation and productivity growth in the sector. Thank you.